So we're going to turn this over now to Dr. Poney Chiang. I met Poney, I don't know, probably about 8 years ago, a while back, and was really impressed. I mean, Poney is a practitioner of traditional Chinese medicine and acupuncture, but at the same time, he has a PhD from the University of Toronto in basic science. So he understands the Western basic science, and he understands the Eastern traditional Chinese medicine. So and understands them in depth. So he's particularly unique. Poney now has an adjunct professor appointment with our Faculty of Health, and back in 2014 and 15, I put a task force together on integrative health, and Poney was a key member of that, helping to chart the future of our faculty. And so Poney's, I thought, would be just superb speaker to come today to give us the insights into traditional Chinese medicine and acupuncture. And I'll put your slide presentation up and you can take it away.
Good morning, everybody. Thank you for giving me the podium today. I have my contact information here if you ever want to ask me some questions about Chinese medicine, or maybe you have a family member you think, is Chinese medicine going to be good for them and help them? I'm happy to point you in the right direction. So today I'm going to give you a little bit of overview of acupuncture, but I want to emphasize that acupuncture is actually one of many modalities within Chinese medicine. So that is to say there are many different styles of performing acupuncture. One of the more common, popular ways these days is something called dry needling that is popular among physiotherapists, especially in the United States. It's starting to find its way across the border now. And that does not require you to have an understanding of Chinese medicine to practice that form of acupuncture, because it is possible to completely separate the traditional energetic paradigm and the philosophical aspect, Eastern philosophical aspect of that practice, and just simplify it down to talking about neurotransmitters, endorphins, trigger points, and things like that. Okay, so I want to just impress upon you that there is a Eastern way and a Western way of doing acupuncture. And I like both of them. Okay, so in my practice, I practice in an integrative way, and I'm going to show you how that is really going to help patients in the Western hemisphere who may already be coming in with a Western medical diagnosis, not necessarily coming in with an Eastern medicine diagnosis, and how we try to use an ancient medicine from the Orient to apply to help people in a modern time in the West. Okay. This is just the outline of the presentation today. I will introduce you to the profession, a little bit about the traditional theories that make up Chinese medicine and acupuncture, a little bit of flavor about how acupuncture might work from a Western medical perspective, because there are a lot of naysayers of acupuncture and say that it's completely just a crock of you-know-what, and it is not based in science. But that's complete ignorance. There's a lot of high-level scientific research that's being done. So I just want to give you a flavor of that. And one of your required readings for this class, for this lecture today, is actually a meta-analysis. And so I'm going to talk a little bit about that research. And finally, I'll finish up with a style of acupuncture you may not have heard before. It's called auricular acupuncture. So what that means is acupuncture performed in the ear. And the reason why I've selected the two forms of auricular acupuncture, which is called National Addiction Detox Association, NADA for short, and something called battlefield acupuncture, is because they are extremely powerful techniques that even non-clinicians, maybe like a social worker, or maybe somebody who is a volunteer at a post-hurricane disaster relief location, might be able to offer to patients or victims something that's quick, easy, and make a significant and profound psycho-emotional change in that person's mind-body state. So what is traditional Chinese medicine? It is actually already an integrated medical system, because the way traditional Chinese medicine has been taught in mainland China for the last 60 years or so, almost 70 years now, is actually already an amalgamation of Western medicine and Eastern medicine. So Chinese medicine physicians have to take biomedical courses and learn about bacteriology, infectious diseases, pathophysiology, and so forth. And they learn to even interpret biomedical lab work, but then reframe it in a way so that they can offer treatment not in a biomedical way or pharmaceutical way or surgical way, but rather in usually acupuncture or herbal medicine kind of way, right? And it is something that is not just found in China, because it's found in Japan, it's found in Taiwan, Vietnam, Korea, and you may not know this, but it's already been in North America for more than 40 years. In fact, in Germany, they just celebrated the 51st anniversary of their Chinese Medicine Congress. So it's been in Germany for 50 years, more than 50 years. Okay, so it is starting to make its footprint in the Western healthcare landscape. And the typical TCM physician is trained in either or, okay, acupuncture and a form of osteopathic massage called Tuina massage or manual therapy, or they can combine that training of acupuncture with Chinese botanical medicine. Then there's also some meditative aspects to this medicine, such as mind-body remedial techniques like Qigong that you had a chance to do just now. So those are all. So there are people that might just decide to focus on acupuncture and Qigong and don't do any herbal medicine. I myself dabble in a little bit of everything, but the two core foci I have are herbal medicine and acupuncture. It is a regulated profession in Canada, and in fact, there are more than 5 provinces in Canada that regulates Chinese medicine. So what that means is that it's actually a GST exempt service. When it's more than 5 provinces, it's GST exempt. Okay, and so when it's a regulated profession, there are certain scopes of practice that entitles and empowers that practitioner who's regulated to perform specific acts. Okay, these are regulatory acts, and for Chinese medicine practitioners, there are 2 such acts. The controlled acts are to perform acupuncture below the tissue, below the dermis, so below the skin, okay, and to communicate a traditional Chinese medicine diagnosis in contrast to a biomedical Western medical diagnosis. Okay? So a Chinese medicine doctor cannot diagnose you with sciatica, for example, cannot diagnose you with post-herpetic neuralgia. That's a Western medical diagnosis. But they can recognize the symptom and reframe it in a Chinese medical language. For example, it could be blood and qi stagnation in your gallbladder meridian, for example. Okay, that's how they would go. They're medically required to chart that way. We're not allowed to chart using biomedical terminology because I'm not a biomedical practitioner. Now I'll show you pictures of using acupuncture with electrical stimulation. That's something that's very commonly used. This is a patient who's having back pain, and back pain is probably one of the most common reasons somebody might seek out acupuncture after they've tried a whole bunch of other stuff and found that it wasn't helpful. Or they're on high doses of narcotic painkillers and they wish to come down from those dosages. This image just shows you something that's called pulse diagnosis. It's actually not just unique to Chinese medicine. It's common to many Eastern and many traditional health systems. And then something that's a little bit more particular to Chinese medicine, it's called pulse diagnosis, tongue diagnosis, where we actually ask the patient to stick out their tongue and we look at the color, the coating. See how this one is very shiny, like lack of coating. This one has a lot of white coating. This is very red. This one is very pale. This gives us an insight, a glimpse into what's going on internally that's out of balance with each patient. It is a medicine that's recognized by the World Health Organization, and as of 1996, the WHO summarized a list of over 40 conditions that acupuncture can benefit. For the purpose of your course on mental health, I've narrowed it down to just these 2 bullets: psychiatry, okay, and addiction. And in parentheses, for addiction, you see NIH, that's National Institute of Health. They've sort of updated this list that the WHO has given in 1996. So you can see some very common psycho-emotional conditions such as depression, okay? Even conditions such as schizophrenia. With addiction, it could be due to alcohol, it can be due to opiates, okay? It can be due to like hard drugs, even tobacco or nicotines. And you may have heard or even know family members who have benefited from acupuncture for smoking cessation. And that's actually one of the year ones I'm going to finish up my presentation today. So a little bit about the Chinese medicine theory. It is considered, okay, what in the traditional medical literature called a humoral-based medicine, meaning some type of vital substance, okay, going even back to ancient Greek, they have this type of medicine called humoral-based substance, where we have these humors or fluids or energetic substance in the body, and should they become blocked or should they become in excess or deficient, then that's the body is no longer in a state of balance or a state of homeostasis, and diseases can occur. Okay, and what's unique about the Chinese way of thinking is because they're heavily influenced by Taoist philosophy. You might know about the yin-yang symbol. So yin and yang are actually two of such humors inside the body for a Chinese medicine practitioner. So one can have an excess of yin, deficiency of yang, and so forth, and that can be a cause of disease. Now, how can we understand this from a more Western medical or modern standpoint? We know homeostasis. One way to understand homeostasis is neuroendocrine or nervous system and hormonal regulation. And if there is an imbalance in your autonomic nervous system, which is the nervous system that is always on autopilot, you don't have to think about how to digest your food, you don't have to think about how to fall asleep, that is on autopilot all the time. That nervous system, should it become out of balance, then you might have heard of fight or flight, rest and digest. That's a colloquial term for sympathetic tone or parasympathetic. So think about yin and yang balances in terms of something that's too hypersympathetic or hypoparasympathetic, and how that can then result in changes in your visceral and hormonal functions. Every organ receives innervation from its corresponding segments in the spine, but it receives influence from both the sympathetic side and parasympathetic side. So that means each organ has a yin and yang. If there is a dominance of one, then the organ could be in excess of yang. So a Chinese medicine practitioner's goal is when they say we're trying to balance your body, what the heck are you trying to balance? Trying to balance the yin and yang. You can think of it as trying to balance the state of your autonomic nervous system to promote optimal baseline functioning of your internal organs. Chinese medicine breaks down the humoral concept in a very Chinese-oriented way, and there are very central to Chinese medicine is the notion of qi. So what you're just doing outside is called qigong. It means qi cultivation or qi work. You're working with your qi or your breath. Ayurvedic or South Asian cultures have something called prana. It's very Greek called pneuma. These things are very common to all ancient cultures. So an acupuncturist, okay, when they are taking their pulse, they're trying to figure out what's going on with your qi. Okay, is it blocked? Is it too little, too much? And then when they use acupuncture needles, they're trying to manipulate qi, hopefully in a way that guides you towards restoration of the yin-yang balance or restoration of homeostasis. We have a concept of blood that's very similar to Western medicine concept of circulation. And this is not working so well right now. But we have something called essence. It's called Jing in Chinese. And that is a little bit unique to Chinese medicine. It is not possible to simplify it and translate that into one English word. It's a combination of notion of hormones because Jing is supposed to be responsible for puberty in Chinese medicine. So obviously, you know that's mostly a hormonal concept. But if you have a birth defect, they will say that you have a gene deficiency from your parents. So that kind of suggests that there might be some kind of genetic or congenital aspect. Okay, so we have those notions, and finally, to save the best for last, because we're talking about mental health, we have a concept called spirit. Okay, and this spirit is what is thought to actually, this spirit embodies each one of our organs according to Chinese medicine thinking. So there's actually a consciousness, not just in your heart, but consciousness of your liver, consciousness within your kidney, for example. Okay. What you're looking at over here on the right, okay, is I don't know, maybe 20 acupuncture needles stuck into a hypodermic needle, just to show you how fine these needles are. So I have even patients that say to me, oh, it's not really like a needle, it's more like a pin. So okay, I'll take that word pin. Okay, if you, because sometimes people have an instant gut reaction when they hear the word needles. But it really is not the same as a hypodermic needle, which is designed to shear cut tissue. Acupuncture needles are meant to actually part your muscle fibers without actually cutting. You know how you get an injection after you get a vaccine or something, it hurts for a couple of days? That's because there's been fascial muscle fiber damage. Acupuncture needles don't do that because they're not designed to cut to tissue that way. This is a pretty standard acupuncture map of the body. You'll see this in any acupuncture clinic. They hang this up in their hallways. And these are meant to symbolize, represent points or energetic centers on the body, and also pathways or lines that connect these locations. So an acupuncturist's job, okay, is to determine which point in your body or which meridian is out of balance, and then insert these needles into the appropriate points and meridians to create a therapeutic effect. And then that therapeutic effect actually requires some needle manipulation. So it's not just poke and leave it and do nothing. There's required a manual skill to direct energy in the way that you would like it to go, to take away energy, to add in energy into the system. Okay? So it's actually, you can think of it in a very energetic way. These pathways are not just skin deep. They're thought to connect to internal organs. So for example, a meridian such as this called liver meridian actually goes into your genital area and then goes into your diaphragm, goes into your liver and the lungs. So one can actually try to influence the lungs and diaphragm through the liver meridian on your ankle, for example. Okay, so in Chinese medicine college, you need to learn, and instead of learning Western anatomy, we have to learn cadaver anatomy, but they have to learn energetic anatomy, and they have to learn, okay, what are the connections between these pathways and these organs? And then that becomes a way that a practitioner may try to influence the lung organ. Rather than doing it through the lung meridian, which is obvious, everybody knows that, but maybe I can do it for the liver meridian because this person is showing symptoms of lung imbalance and liver imbalance at the same time. Okay. So I just want to start to give you an idea how a practitioner goes about. There are 61 acupuncture points in the body, and each of them have a correspondent to a meridian. So for example, there's a meridian that I'm showing you here. It's called the pericardium meridian. Dr. Stinner mentioned Lao Gong point. He mentioned it was on the pericardium. That's actually pericardium 8. Okay, so that's the point over here. Okay, he's not making it up. It's right there. Okay, and yeah, and so we learned that these points belong to certain meridians, pericardium meridian. So therefore, something to do with the heart. It can help you relax, focus, calm the mind, and so forth. And in the West, in order to facilitate the teaching of Chinese medicine, rather than using Chinese names of the point, as you heard, Lao Gong is the pericardium 8. We just give it an alphanumeric name, so it's easier because learning Chinese is Chinese medicine is hard enough. You have to learn Chinese. Okay. But what are these acupuncture points? That's actually my personal area of research. And after having studied a lot of anatomy literature and doing acupuncture cadaver dissections myself, I've come to a general impression that when ancient people pass on these points, they are telling us how we can stimulate the peripheral nervous system. Because we see time and time again, these points are located either over nerve trunks or where nerves trifurcate or bifurcate. For example, these are forks in the road. You see that over here? Division points. So they had an amazing understanding of peripheral nervous system anatomy and felt that it was important to preserve this knowledge and pass it on for posterity. And they happen to be in the form of acupuncture points. I want to give you some useful tool for you, just sticking with the pericardium meridian theme that we started. You might have seen these devices when you go on a cruise, these kind of seasick, nausea type of bands. That usually is a magnetic device, okay? And as you know, magnetism, electricity are inversely proportional. So you know the nerve system communicates to electricity. So when you apply a magnet over a nerve, there will be an electromagnetic field effect on that nerve. And so when you get these bands on the cruise ship for nausea, okay, you're actually stimulating something along the median nerve line that creates a what's called vasovagal or autonomic nervous system effect. And that's how it's actually able to help you with symptoms of nausea. So this point is very easy to find. Okay, you just take 3 fingers. Okay, line it up to the to your wrist crease. Okay, and then so that from that distance, push in between the 2 tendons. See how I'm accentuating the 2 tendons, popping it out right there. Put it between the 2 tendons. That's a point called inner pass or naguan or pericardium 6. Super helpful for nausea, for even just when you have pre-exam stress and pre-exam jitters. Press that, calm yourself right down. Okay, you can even do it at both hands at the same time. But really kind of dig in there, push in there, and kind of like shake it side to side. Because it's not an acupuncture needle, you're doing it through your hands, so you need a little bit more oomph to give a larger result. Okay. Somebody feels nauseous, somebody feel like faint, that kind of thing. You can immediately give them some ancient Chinese first aid. Now, I promised that I would give you a little bit of the science behind acupuncture, and the science is being extremely well worked out. So much so there's actually Western medicine textbooks called Introduction to Western Medical Acupuncture, published by White and Cummings, that goes through the neurology of this. Okay, so I don't want to bore you with that. There are thought to be 4 levels of effect: a local effect. So when your needle put into the skin, there's an immediate response to the affects of blood vessels and endorphin release and so forth. That message carried by the nerve goes up to your spine, so then it has a segmental effect. It goes up the spine to your midbrain, which then has what's called an extra-segmental effect. Finally goes up to the forebrain or the cortex itself and has a central nervous system effect. So acupuncture, even though it's stimulating the peripheral nervous system, ends up having a central nervous system effect. And I want to jump right to the central regulatory effect, because that's the part that has more to do with our emotions, our affects are up here. First of all, why is it that there's a need to talk about emotions when we're talking about acupuncture, which is usually mostly known for its amazing prowess in treating pain problems? The reason for that is because when the pain becomes chronic, it's no longer a physical experience. It becomes an emotional experience. People started attaching meaning to that. The pain changes their behavior because they want to avoid putting their limb or joint a certain way that causes a problem. So then they cannot play with their grandchildren anymore. That pain affects their sleep at night. So you can see how that pain now changes the person's life, the way they interact with the environment, the way they make sense of their own pain and their relationship to other people and how they interact with other people. So there's a social cost and not just an emotional cost when it comes to somebody having a chronic pain. And all this goes to a part of their brain. It's called the limbic system. Okay, and there's the reason why I want to talk to you about this, because there are some people that is actually doing functional MRIs, which is looking at how when you stimulate acupuncture point somewhere in the body, how that can change the level of oxygen levels in different parts of the brain. So somehow needling on the body peripherally can change blood flow to specific centers of the brain. That's called functional MRI. Okay, and they're being able to show that when they give acupuncture and cause a painful experience, it lights up the somatosensory cortex in the brain as expected. But when they manipulate in the right way, which is something called de qi sensation, de qi is a feeling that a practitioner is trained to do to manipulate needle to give kind of a comfortable sore, not a sharp pain, but a kind of achy dullness. When you get that feeling, and only when you get that feeling, it actually activates part of the limbic system. Right? So it lends credence to the notion that there's some specificity to what you're doing, what point, but also how exactly you're manipulating that needle to create that effect. If you simply poke that point with a nylon fiber, which is what they use as a device to elicit some discomfort, it doesn't have that effect on the limbic system. Okay. Acupuncture has also been found to have a lot of effect on the parasympathetic state. So patients usually oftentimes will fall asleep on the table, okay? Or they'll report that they slept really well that day. Sometimes you have an emotional catharsis. People start crying, okay? Or people start laughing uncontrollably, okay? And that's thought to be therapeutic because it's releasing some pent-up emotions, emotional stagnation that's got unblocked. Sometimes you can have an unfavorable response where somebody actually faints. So the needle stimulation was too strong, okay? But that still goes to show you that the acupuncture is not imaginary. It's not going to cause somebody to faint if it actually did not create a parasympathetic or vasovagal response to the body. Okay. Now we come to the part of the presentation that I want to discuss the meta-analysis paper that was part of your reading for this class. And what's phenomenal about this paper published in 2012, okay, in the archives of internal medicine, so not a complementary medicine or not an acupuncture medicine journal, an internal medicine journal, is that not only was it a meta-analysis, it's a meta-analysis of meta-analysis. It's the mother of all meta-analysis research. Okay, so what they call this called individual patient data. What that means is that they looked at the meta-analysis research that has been done in the past and screen them for eliminated the ones that are just poor quality, but the ones that are sufficiently decent quality, they went to the researchers and they asked for the original data for all the researchers, collected all the data from different researchers, then put statistical power on them. So the findings are very, very powerful. Oftentimes with these studies, or any studies, even drug studies, people will finish with a conclusion caveat that the more studies are needed because the study size is too small. We need to repeat this with larger size. Well, here's what they've done is that they've irrefutably come to collected as many data as possible and then analyzed its effect for treating chronic pain. And they decided to focus on 4 different types of pain: migraine, okay, neck and back pain, joint pain, and then shoulder pain. And the inclusion criteria is that the pain need to be has to be more than 4 weeks in duration, okay? And because if it's only been around for 1 week, maybe tomorrow the pain goes away. You don't know if it went away on its own or the acupuncture actually made it go away. So you want to limit that doubt. And then your endpoint measure is that you measure what happens after 4 weeks after the acupuncture. So you make sure that the pain didn't come back, okay? That acupuncture actually had a sustained result. Okay, a lasting, permanent, semi-permanent result. Okay, and they were interested in having studies that obviously was randomized control, but it must satisfy number 4 here, inclusion criteria number 4, that it does not have something called unambiguous allocation concealment. What that means is that when you allocate a group to getting acupuncture and allocate a group to getting control, for example, that allocation is very clear exactly how you did it, and is done in a way that is not biased, or will lead to the patient being able to figure out whether they're in the control group or in the control and in the treatment group. Okay, because obviously you can see how that will have a confounding outcomes. Now, how do you do acupuncture that's a control? That's the biggest challenge to acupuncture researchers. If you get acupuncture done, your needle poked in you, you would know you got poked by a needle. So how do you fool somebody into thinking that they got poked by a needle? It's really hard because you didn't get poked, you know you didn't get poked. Okay, so these are some of the challenges that acupuncture researchers, and so they've had to compare the data based on whether the research used what's called a sham needle, a fake needle, okay, or research that use a non-needle control, such as like a TENS device, which is like an electrical pads that give you a muscle massage feeling that you get from like Dr. Ho. So everyone knows Dr. Ho, those pads. So that can be a control, but that's non-penetrative. Or you can have actual penetrating needles, maybe just at a non-acupuncture point. So you're looking at the specificities of that point's effect. You put it somewhere else, it's not a point, does it have an effect? Okay, you comparing that to needles that are actually penetrating or non-penetrating. and is it actually the act of penetrating the skin that has the effect? Right? So they want to first establish, okay, is acupuncture more effective than these sham controls? So that would lend credence to the notion that acupuncture has some form of specific effect. And they got raw data from 29 trials, okay, and so that's around 18,000 people. Okay, so it's very, very rare to ever see studies of that size and magnitude. This is a picture of what a sham acupuncture needle looks like. Okay, so it's placed on the point, and they might actually be a percussive or pressure feeling on that skin. So the patient has their eyes closed, both the patient and the control and the actual intervention group had their eyes closed. Then they can only rely on their sensation and so they could conceivably be fooled thinking that they had acupuncture because they felt something, okay, on their skin. So presumably the actual acupuncture will have a similar base, except that there will be penetration. So the only difference was the actual penetration itself. The pedestal and the base, it's the same whether there was penetration or no penetration. Okay, so these are the what's called forest plots of the four different types of pain that they were studying. Okay, and this is the shoulder pain and measured. So I'm just going to summarize the finding for you. So they have found that compared to the sham control, okay, and there was statistically significant, so p-value of less than 0.001, between the effect of acupuncture versus sham for migraine, osteoarthritis, and back pain. So not for shoulder pain in this case, okay? And but I want to bring your attention to something called effect size. Okay, effect size is a negative value over here. Apparently, the negative values they're smaller or they're even more negative, the better the outcome. And the way you interpret the effect size is as such. If you know the statistically significant, but statistically significant may not actually be clinically useful. Okay, because it's simply a number that shows statistically significant. Exactly how significant is it? Okay, I know there are p-values. I mean, 0.05, 0.01, 0.00001. Okay, and this is already, they're all the same. So then, how do you determine which one have more effect? Because they're all statistically significant to 0.001, right? So you can't just use the statistical number alone to determine the effect. So statisticians have come up with something called the effect size, where they're able to determine how much more effective. So one could say, for example, that the effect of acupuncture versus sham on the migraine, which is 0.15 versus 0.16, is very similar, the similar effect between migraine and osteoarthritis. Okay? However, lower back pain, neck pain appear to be a little bit more effective. Okay, but in the grand scheme of things, being less than 0.3, this effect was considered a small effect. It's not a huge, even though statistically significant, one can jump into the conclusion, oh, it's very effective. Okay? It's modest in its effect. But we'll come back to that and see how one need to interpret that in a clinically relevant manner. Question number 2 of the study is that, is acupuncture better than non-acupuncture controls? So what are the standard of care these days? It could be, the standard of care usually could be a pharmaceutical medication for pain, okay? It could be just wait, okay? Or it can be give them a lot of attention, talk to them, reassurance. Medically, is actually a technique called reassurance, okay? It's gonna get better on its own. So these are, in comparison to these non-acupuncture control techniques, how did acupuncture measure? How did acupuncture fare? So now we'll focus on the lower part of the chart here. You're comparing acupuncture to non-acupuncture. Again, statistically significant, okay? But there is more of an effect when you compare it to the standard of care. So what I'm trying to say is that a clinician's job, when they decide whether they should recommend, a family doctor should recommend acupuncture, they're not sitting there thinking, should I recommend between sham acupuncture or real acupuncture? they're thinking, should I recommend acupuncture versus some other existing care, right? Because you're not ever going to prescribe sham acupuncture on somebody. So that's the difference in the effect size. These numbers might seem not very impressive, but these numbers do not reflect actual clinical practice. What's reflecting clinical practice is determining, is it going to be better than drugs? Is it better than just waiting? And you can see that these numbers are now closer to 50%, which is in the moderate or intermediate range of effect. So just to conclude, the effect of acupuncture over sham, okay, is about 40%. The effect of the sham needle over standard care, non-acupuncture care, is 60%. So together, that makes up the true percentage of the acupuncture. So acupuncture's effect is going to be comprised of some specific effect, okay, over a non-specific needling, versus in addition to its effect that is better than, let's say, pharmaceutical effects or attention reassurance type of effects. So this paper is considered to date one of the most statistically powerful supporters of acupuncture because of its size, but also demonstrating that there's definitely specificity to the effect. That is not a general effect. I want to finish up with auricular acupuncture. And the reason why I'm showing you this picture first, okay, is the different colors here represent different nerves that innervate your ears. Okay? And the most important one here is the one in green that covers this concha cavum area of the ear and also a little bit of the tragus area over here. This nerve is one of the cranial nerves called vagus nerve, cranial nerve number 10. And it is responsible for 90% of the body's parasympathetic nervous system. Okay? So this nerve that goes to the ear from the vega has a specific name. It's called Arnold's nerve, or sometimes just called the auricular branch. So this information leads some credibility to certain styles of acupuncture style called microsystem acupuncture. You might have seen a reflexologist that massage the bottom of your foot and claim through experience that your baby toe hurts, so therefore there might be something wrong with your pineal gland, for example. That reflex or microsystem correspondence exists in Chinese medicine, and in particular the ears. And a funny thing about this is that this system of medicine called auricular medicine exists in the East and exists in the West as well. The French and the Germans have a long history of this of their own. Okay, and by any case, so the notion that one could affect your stomach or affect your sleep through needling or stimulating the ear can possibly be explained to the effect of the parasympathetic nervous system by virtue of the vagus nerve. So it's not just complete hologram and rainbows and unicorns. Okay, there could be some neurological explanations, and specifically autonomic nervous system explanation to this. The first auricular acupuncture protocol that was introduced to practitioners is something called the NADA protocol, and it stands for National Acupuncture Detoxification Association. In fact, Toronto Western General Hospital, okay, has an addiction and mental health unit that offer this. It's covered by OHIP, okay, this NADA protocol. And it was developed in the 1970s by a doctor called Michael Smith in New York. I forget which hospital in New York. He's now since passed away. And it uses points that affect the liver, affect the kidney. Even in Western medicine terms, you know that those organs are related in detoxification, right? Who has done a liver cleanse recently, right? With this notion that organs and kidneys filter your blood and things like that, it's common to Chinese medicine. So they use points like that. They use the lungs because if you're smoking things you shouldn't be smoking, then it's going to be toxicity in your lungs, right? So you choose a lung point. They're sympathetic to affect the nervous system, the autonomic nervous system. And there's another point called Shenmen. Shen means a spirit gate. It affects the mind and calms the nervous system and as such. So this is being used very successfully in hospital settings in Canada, okay? And but it's very popular in in private practice for somebody that comes in and asks us, can you use acupuncture to help me quit smoking? So if a practitioner says yes, 99% of the time they will be using this NADA protocol. So if it's able to help you with substance addiction and things like that, that means that it's able to affect your not just your peripheral nervous system, it's able to affect your central nervous system. Okay, you're affecting your reward systems in your brain. Okay, it's affecting aspects of the limbic system as well. Okay? Another one that's more of a latecomer is something that's called battlefield acupuncture. And as the name implies, it's used in the battlefield. It was created by a Navy colonel by the name of Richard Nimtau, okay, who is now retired. And he is in charge of a $5.4 million project from the Joint Forces to study how acupuncture, specifically his point combination, can be used in veteran hospitals, can be used in the battlefield. The idea is that this is something that soldiers can do to each other on the battlefield, and you don't have time to disrobe in the battlefield, right? But the ears are usually readily available, so we can quickly affect the entire body through the ear. And the points that they use, thalamus and singular gyrus, okay? These are terminologies that pertain to the limbic system. We talked about how the limbic system is so important in terms of the pain experience. We have a point called that is shared between the two protocols. Another protocol has this as well, Shen Men. It means a spirit point. So if you just look at this little triangle part of the ear, everybody should be able to feel that triangle part over the ear. Okay, if you find the tip of the triangle, that's where the Shen Men is. That's another point you can use to calm your nerves down. Okay, if you're feeling stressed out, even or insomnia, find this little triangle part. Find the peak, the apex of that triangle. So this is the triangle I'm talking about over here. Find the apex of that triangle, and just don't be afraid to put your nail and just poke at it a little bit. Okay. So this has been used in the military, not just for chronic pain, but they found this to be very effective for post-traumatic stress disorder. As you know, in the old days they call it shell shock, right? And the soldiers come back home, they don't connect with people, they have nightmares, they wake up in the middle of the night, they think their wife is their enemy, chokes them out. This is a serious problem. That affects police officers as well. But maybe you don't have to be a member of the law enforcement or armed forces. If you've suffered a motor vehicle accident recently and you're reliving that experience every time you get into the car, every time you walk near that intersection where that accident happens, that trauma is relived. We use the same protocol to help patients get over this psycho-emotional trauma. And it is very popularly used in the disaster relief locations. It's been recently used for Hurricane Katrina, and one of my students actually used it in Puerto Rico. You know, there was a hurricane there recently that Trump apparently didn't really spend too much money on, except throwing paper towels at people. And that's the one I'm talking about. So one of my students was doing this, battlefield acupuncture and another protocol in Puerto Rico to help those victims of the hurricane. Okay. Now I'll finish with a little case. This is something I just did yesterday because it's fresh in my mind. So I've slapped this together last night. This is a style of acupuncture. It's called scalp acupuncture, and it's a real intersection of traditional acupuncture with understanding of the central nervous system. There are numerous protocols that use electrical stimulation of the scalp. So they use acupuncture as a delivery mechanism for this electricity. Here I'm showing you 2 points, one on the hairline, one between the eyebrows. The 2 needles will be inserted here, and then wires to connect them together to stimulate the forehead region. In the temple area, there's another acupuncture point. Above your ear, there's another acupuncture point. So 2 needles will go there, but then you have 2 wires that connect that. So the person has 3 wires going on at the same time. Okay, and this paper that came out very recently was only a case study, okay, but it's very well known, 2014, in the Journal of Global Advances in Health and Medicine. But things like this is quite well known to Chinese business practitioners. It doesn't matter whether they use electricity or not, because I've personally found electricity is a bit more powerful. And this was a case study to treat anxiety, general anxiety disorder. So I want to finish up with a little case study of a 35-year-old East European male. His occupation is he's a hospital chaplain. And so he's a very spiritual individual. I think he's got like a Eastern Orthodox priest-like training, but he's also trained as a chaplain. kind of like interfaith kind of chaplain. And so very spiritually connected individual, very compassionate, but he has a long history of anxiety and panic attacks. So since 2018, he's developed palpitation and panic attacks that can happen once or twice a day. But this person has elected not to take any medications because of the fear of the side effect. To be honest, he's probably anxious about the side effects, okay? And you'll find that to be the case for a lot of the anxious patients. So since June, just last month, he started to feel very negative, okay? So that's his way of saying he's feeling very depressed. Everything is like a glass half empty. Everything has a cast of dark clouds over it. Everything is dark and negative and drawing in. And he's feeling chest pain. He's feeling shortness of breath, okay? And he's anxious about going to bed. What if I go to sleep and I don't wake up again, okay? And he sometimes wakes up in the middle of the night with palpitations, right? So the reason why he finally came to see me, he saw me many years ago, and so you always wonder why didn't it start coming in 2018, waited till June this year, is because in the end of July, he's gonna go fly to his home country, and he's worried that he'll be trapped in the airplane, being claustrophobic. He's like, if he's feeling anxious in here, he can walk out and go do Qigong outside, but he can't do that on a plane. So he's really worried about what's gonna happen to him if that happens. He freaks out on the airplane. So that was enough to finally motivate him to come and see me. And so what I decided to do was a combination of that scalp acupuncture we talked about and the battlefield acupuncture. Okay. And the beauty about the battlefield acupuncture is that those needles, I want to show you. There's a little picture of an applicator, kind of like a syringe, but it's actually like a little earring. It's like an earring stud. The patient can go home with this. So there's more of a lasting effect than just while you're there on the table. For as long as those studs stay in the ear, often it can be 2 to 7 days, you're getting continued acupuncture. So I propose that this guy should get 10 treatments, 2 treatments a week over 5 weeks. This way we get as many treatments as he can before he leaves at the end of July, okay? So in addition to the scalp and ear, I also use points on the body that are known to promote parasympathetic states. Okay, I won't go into what they are, because unless you study acupuncture, won't really be useful. Okay, but what's very interesting is that he could not have been a better responder. After 4 sessions, which is conducted twice a week, so just after 2 weeks, he stopped having palpitations. Okay, and after the 7th session, he actually says he starts feeling positive and has not had any panic attack in the last 2 weeks. This is an individual that usually has at least 1 panic attack every day, possibly 2 a day. Okay, and what I like to say is that I was actually away between 4 and 7, so one of my associates just did this exact same protocol. So it's not just something that's unique to me. You just follow this technique. The nervous system is the same from person to person. You follow this technique, you can get very reproducible and sustainable results. So this patient is very happy, and therefore he says that he volunteers his wife to also get this treatment, even though his wife is not so interested, but he feels like, misery loves company. So he booked his next appointment. I can expect to see his wife at the same time, okay? Unwillingly. Okay, so that concludes our presentation. I hope we're doing okay for time. And I'd be happy to open up the floor to answer any questions, and we can have some meaningful dialogue, some exchanges. Okay?
So I also want to thank you too. Amazing clarity of your presentation, but also the slides. So the slide deck is up on the website, and we're taking the video. So probably in a week or so, we'll have that up as well, so you can review it. But I thought it was incredibly clear presentation. I have a number of questions, but I really want to open up to our students first. So maybe say your name and then and speak on the mic so we can get it on the video. Okay.
Thank you for your presentation. My name's Samir. Speaking from experience, I suffered a concussion a couple years ago, and part of my physio, my rehab, I actually went in for acupuncture. And I went in for a couple of visits, right, several visits. And in the first visit, I didn't feel like I got much of an effect at all. And I disclosed that to my physiotherapist, and she told me that part of acupuncture is you gotta have a psychological component heading into it. You have to almost be in a state of suggestibility for you to see the effect. And actually, oddly enough, after I was kind of more open to that, I started seeing some of the positive effects. So I wanted to like throw that back to you and ask you, do you believe there's a psychological component? And like, because you mentioned your client's wife is coming in unwittingly. Do you believe that she may or may not have the same effects as her husband because she might not be in the right openness or the state of mind?
There's always going to be a psychological or placebo effect with any intervention. The classic counter argument towards that is that veterinary acupuncture is very popular and animals are thought to be immune to the effect of placebo. But then also there are measurements people can measure your blood before acupuncture, individual acupuncture. There's actually biochemical changes. So whether you believe it or not, your blood is changing, okay? So that's my response to that. But of course, there are going to be people that are better responders. Some patients will come in and say, my results for this is some problems I get 90% result, but this one here, I'll be honest, I get 50% result. Let's do 4 treatments. If we don't get any results, let's stop, okay? So that's some rapport building, but also so that honesty and that connection, even if that patient may be skeptic about acupuncture, they'll feel, hey, this guy is not trying to make me do like, there are some practitioners that have you come 3 times a week for like 10 weeks. That's 30 treatments, right? Yeah, there's some, I'm not gonna name what type of profession, but there's some professions that do that, okay? So you can see how immediately, whether you are a believer or not, you might have a negative emotion about that, right? Yeah. Anyway, so hope that answered your question. Yes.
That's a comment. I mean, that is a great question. Your slide, I thought, really powerful, showing of the effect size, how much will be from the sham, how much the true effect, and about this case 60% versus 40. But we do research on psychotherapy, and there it's very difficult to show specific effects. So is it the therapist's effect, or is the fact I'm using cognitive behavioral therapy or emotion focused? And drug trials, at least a third of the effect is just due to placebo expectation. So it's not, don't put this just on acupuncture. And if you believe in it, because something's happening, your brain's influencing your body, right? So how can you more encourage people to believe in the effects? So that, to me, there's some real good learning from this. But that's really a great question. I thought that slide is one of the most useful ones that I'll be able to take forward if people are criticizing, acupuncture.
I just want to start off by saying thank you for your presentation. And also, I really connected to the point when you're like, some people get a strong emotional reaction when they try acupuncture. Because for the first time I did it, I was like uncontrollably laughing. My mom's like, what's going on? Like, why are you laughing so hard? Nothing's funny.
Nervous laughter.
Maybe it was like, oh my God, there's needles all over me. Like, what is this? But after that, it ended up being like really soothing. And I wanted to ask you, how do you find that acupuncture can like treat addiction to like opioids and things like that?
So I've actually, addiction is not my sort of area of passion. Pain is. So a lot of times people come in already being on narcotic grade opiates, okay, for their pain. So and they are addicted to them. Right? So my experience with those type of patients is that I'm obviously trying to address the biomechanical and neurological or muscle or joint related reasons for that pain by using very anatomical approach to try to affect the tensions, the entrapments and things like that, right? But at the same time, that's where the integration part comes in. I assess the person's emotional state, and I talked about each organ has a spirit. Is this person due to too much heart fire? Is the heart overactive, or is it just like blockage to the liver? Is this person's emotional addiction more of a liver reason or a heart reason, or is it due to fear? In which case, would be Chinese medicine would be attributed to the kidney. So it takes no extra effort for me to maybe add 1 point for the kidney in the ear, or another point for the liver on the foot, for example. So I try to take each individual's addiction in an individual way, and I know addiction is created equal. And then I superimpose a layer of try to create a parasympathetic state to the person, because being in a parasympathetic state, being in a relaxed state, automatically increases your tolerance for pain. A lot of these patients who have chronic pain are in a constant fight or flight. They also have it in insomnia as well, which doesn't help, which even creates even more fight or flight. So if I can calm the nervous system down, that will already give them less pain. Then they will find that for the elective medicine that they take as needed, the doctor gives them, they're not taking the elective ones as much. Then we can talk about going back to your family doctor or your pain management specialist and say, what about the prescribed ones? Can I now try to reduce the dosage a little bit? Yeah. So that's the process I take in terms of the opioid addictions.
Thank you.
I get good exercise here today.
Hi, I'm Layla. As everyone said, thank you for your time and your presentation. I had just like a reiteration and then a question, but it's, I had chronic back pain and I went to a physician. There was nothing. I did a physical. There was nothing, like anatomically and everything, I was fine. And then the doctor suggested it might be stress related, but this back pain was like years of it. And as soon as I went into acupuncture, I found that because I wasn't feeling the pain, I was less upset about it. And like it was kind of like a cycle, which led into getting better. But what if, and this is based on experience, what if the acupuncture hurts afterwards? So the spots where, you know how you were saying if you get a needle and the normal needle will hurt more, it's sore. If that happens to you during acupuncture, does that mean it was done the wrong way, or is it based on like case by case, or?
Depends what the practitioner was doing. If the practitioner was actively trying to deactivate a trigger point, they might actually go in there, do what's called a fascial pecking technique, try to create a little bit of micro injury to awaken body's natural healing restoration mechanisms. So if they have that type of manual stimulation, we will tell patients that you expect this to hurt for 24 hours after. Yeah. Okay. You know, it depends on the region. If I'm treating a TMJ, you put a needle in your jaw, those can hurt 2 or 3 days. And so it's important as a practitioner, just for rapport, but also just reassurance, tell them how long to expect that discomfort. Yeah. Otherwise, you're gonna find they call back the next day. You know, what's going on? You know. Yeah. Yeah. So my solution to that is just preemptively tell everybody you're gonna hurt for 24 hours, but it's not a sharp pain. It's an achy soreness, kind of like the feeling you get after a workout. Okay, that you don't have to work out, you have a little sore, but that's your body actually repairing the muscle and growing the muscle. It's like that kind of achiness feeling. Yeah. And again, pain is experience is cultural. You know, like some people, if they leave the acupuncture, don't feel anything. They think it's great. Oh, the acupuncture is so skilled. I didn't feel a thing. Acupuncture, oh, did I even get anything done? Some people are skeptical about the acupuncture. It's like in the East, they actually think you ripped them off. Yeah. Why do you pay you this money for? And I didn't feel a damn thing. Okay, so seriously, so they actually, so I'm known for more heavier stimulation, but it's probably because I have for certain type of problems, I find that gets faster results. So I explain to the patient, I can stimulate heavier, a bit more uncomfortable, but you get results faster. Okay, so I can get results slowly, comfortably, but most patients say, okay, do it faster. Yeah, yeah. So you tell them that. Okay, and I overhear some patients talking to my staff. It's like, oh, you know what? Like I really like him because his needles hurt the most compared to other people, you know. So I don't know if that's a compliment or not, okay? But some people feel that they there's some effect, you know. So you obviously different patients will gravitate to a different type of practitioners. Yeah.
Do you practice in Toronto?
Markham.
Okay.
Yeah.
One more question.
You had some questions.
You know, I just make commented about different schools of acupuncture, because I've been going to 13 years now more to my acupuncture guy Mark, and he was trained in Japanese, and it's a bit different philosophy. So the needles just barely break through the skin, and he's very much like he spends a lot of time checking the pulse, and he said that takes almost 10 or 20 years to be, and different parts of the pulse relate to different organs. And that's sort of a key part of his practice. And he's then putting in point, only he's trying to balance, and he checks that through the pulse. Anyway, that's a Japanese approach. But I know just maybe leaving comment on the different schools, and you mentioned, and maybe a concern as acupuncture is being picked up, say, by physiotherapy and others who may not have the depth of training, concerns over that. And I know you yourself are doing some training programs here, so you might just comment about some of the different approaches, and then just end up with what you're doing, the training, the certificate program you're doing for us here in our faculty.
Okay.
Yeah.
So different effects. I personally find the superficial effects of acupuncture to actually be better at treating internal organ visceral related problems. Whereas in contrast to orthopedic problems like a sports injury or sprain and knots and tension and tightness and refer pains and that sort of stuff, like the tension here, you get headache. I find that the deeper needling, targeting specific muscles and free up nerves is more effective for the orthopedic problems. But when somebody comes in for insomnia, somebody with digestive problems, my needling tends to be more gentle. Okay, I still get that dirty feeling, where that kind of comfortable aching feeling, but I'm not like trying to jab and break up knots and break up ropes and things like that. Okay, my suspicion is that obviously if you're needling at a superficial level, you're affecting sensory cutaneous nerves. And that will have a greater effect on the autonomic nervous system, because we happen to know that sympathetic fibers travel together with the sensory fibers. And then this appears to be consistent with the findings of people who have different trainings. They will use acupuncture style or more superficial approaches to treating actually deeper problems. So that's actually an application of the yin and yang idea, where you use opposites to treat the same. So if a deep problem, you actually do shallow, but for superficial problem, you go deep. Okay. So in terms of the training about people that are non-acupuncture doing Chinese medicine, doing acupuncture. So for example, physiotherapists that do acupuncture, they have to practice acupuncture within the scope of practice, which is mainly physical conditions. Okay, they can't do acupuncture for digestive problem, for infertility, for example. That is internal medicine aspect. So that's outside the scope of practice. So I'm pretty okay with the fact that other people are doing acupuncture, as long as they don't overstep their scope or their area of expertise. But at the same time, since you are learning about global medicine, you're having a global perspective, you're having East-West and traditional and indigenous perspective, I think it's important to validate and honor those traditions, And in fact, when I teach the program at York University, I have an intro. It's a program for licensed practitioners, so it's continuing education. It's not for entry level, and so people are already licensed acupuncturists. And we because we're inclusive and integrated-minded faculty, we enroll physiotherapists who have had more than 200 hours acupuncture training, which is what's required by the World Health Organization. So we enroll naturopaths that have, or medical doctors, as long as they demonstrate they have what the WHO requires for medical training, then they can do this program. So those practitioners don't have a very strong Western, Eastern understanding. So I start my presentation by showing you pictures of ballet and also modern dance, like looking at traditional Colosseum Roman architecture and modern stadium, okay, or molecular gastronomy versus French traditional cordon bleu cooking. And you'll see that it doesn't take very long for people to understand that the modern stuff didn't come out of nowhere. Okay, in fact, some of the best modern dancers or modern musicians, jazz musicians, whatever, have the deep classical training. Okay, so how are you going to know you created something new if you don't really know what came before you? Even in modern research today, sometimes we find these things that we discover, but they knew about this in the 30s, So this is just within Western medical research. Forget something that's from a different time era in a different continent, in a totally different philosophy. So I did my part to try to hopefully inspire people to don't underestimate, don't belittle something that just is old or is from a different culture and tradition, because what you're doing now actually is a direct result of what came before you.
I think that's an incredible way to close your presentation, and I think the wisdom of your final comments, for us, how it resonates really with different perspectives of the course and what we're learning. So I really want to thank you. And part of thank you is we've signed a card. This is one of our Indigenous artists. So I
Oh,
want to give this to
thank
you on
you.
behalf of
Awesome.
our students. And really, I thought it was
Thank you.
great. Thank
I
you
really
very much,
appreciate
Poney.
this. Thank you. Yeah.